The Region 5 Regional Health Officer delivered a status report on drug supplies in the region at the recently held RDC meeting. Sasha Ramsaran reports.
At the first statutory meeting of the Region 5 Regional Democratic Council on Thursday last, Regional Health Officer Dr. Stephen Shifun, in response to a request that was made by the Council at their last statutory meeting on December 15, 2016, presented a status report on drugs and medical supplies in the region for 2016.
We order drugs based on a VEN system which is called vital, essential and non-essential. The drugs that are vital, they're critical to sustaining life. You need those drugs so that you can have in the case of emergency, something comes into the hospital, you have to get these drugs. The status of those drugs, we are all in stock of that, in excess, I must say, and all our facilities have these drugs. Under the essential category, that category is drugs that are essential to maintaining like chronic disease, as we would say, diabetes, metformin. So under that category, you have diclofenac, Panadol, and this. Now, all time we try to ensure that we have these drugs in stock, the essential drugs. However, sometimes you will have a substitute because a patient is not dependent on that tablet. So in cases where a patient, they're not dependent on a certain tablet, we can give the substitute.
In presenting a synopsis of his report, the RHO emphasized that the region is in a good place when it comes to its supply of drugs.
On the drugs and medical supplies is that our region is in a good place in that we have profiled all disease in each catchment area. We have distributed drugs based on that catchment and that disease profiling of the areas, and we have treated all the ailment. As present, because of the status that the status of the drugs and medical supplies in the region, we have managed to optimize a lot of chronic disease that were unoptimized for years. Patients were having their sugars out of control, and every time they come to the clinic, it's 300 and above. But because of effective management by our doctors and nurses and all healthcare providers, we have managed to have patients have a constant blood sugar on checking in the morning FBS below 200. We do not short supply our patients. What we do is try to give them the amount of drugs they need, and we talk more to our patients to make them know that you don't just take the tablet when you see it fit to take it. You have to take it constantly because it's a chronic disease or what you have. So patients have more understanding on what they are affected with and how they can properly manage it with the pills we give them.
In his conclusion, Dr. Shifun made a commitment to deliver a healthier region and a nation.
Our vision stands on the long-term objectives of Ministry of Public Health. That is, the residents of Region 5 should be amongst the healthiest of Guyana. And not only in Guyana, they should be amongst the healthiest in the Caribbean and the Americas. And I stand firm by that. And with the healthcare sector along with the administration, we will deliver a healthier nation.
Sasha Ramsaran reporting for Channel 8 News.